Our community intervention was done at St. Francis Xavier Catholic Hispanic Church, which is at 2515 East 1st Street in Tulsa, and their phone number is 918-592-6628. And there were 32 members present at our presentation, and they were between ages of 18 and 74. And we were able to get a translator, so we spoke and the translator translated for us. During our PowerPoint presentation, we discussed factors that affect cardiovascular disease, and we included obesity, lack of physical activity, high blood pressure, smoking, and also the signs and symptoms of a stroke and a heart attack, and regular doctor visits and the importance of seeking medical help when needed. And we had many questions that were asked after our presentation that we covered, and one of the questions was, what are some of the signs and symptoms of a hypertensive person? Signs and symptoms of hypertension include headache, confusion, visual problems, chest pain, difficulty breathing, and low energy and tiredness. And we also wanted to see if any of the members have been affected by cardiovascular disease. And we've had several people raise their hand, and we're able to have examples of friends and family members that they lost to cardiovascular disease. And one of those examples was by a member who lost a cousin, and he was only 25 years old, of a sudden heart attack, and the person didn't even realize that they had high cholesterol, and they just passed away. So they're aware of the problems of hypertension and cardiovascular disease, and a lot of times they're not sure what needs to be done to correct it.
Okay, we also talked to them about stroke. We told them about the food that you can eat, like signs and symptoms of stroke, and what are the kinds of things you can do to avoid getting a stroke. And you can see right here, this is a flyer that we made and gave to them. We have here some of the signs and symptoms of a heart attack on this way, and this way we have some of the signs and symptoms of a stroke. Now for the signs and symptoms of the heart attack, we have fatigue, chest congestion or pain in one or both arms, nausea and indigestion. And for stroke, we have dizziness or loss of balance, confusion, speech problem, and numbness of one side. And then we went further to get, I don't know if we have a pyramid right here, which we kind of explained to them, and this kind of shows some of the foods that you can eat to stay healthy, so you don't find yourself getting one of these diseases. So some of the foods that we have right here, we have limit intake of red meat and butter, low fat diet and soy milk, water at least 5 to 8 glasses a day, legumes, whole grains, vegetables, light, high. Okay, we also had on our flyer 4 steps to prevent cardiovascular diseases. And the first one is don't smoke. The second one is regular exercises. The third is eat healthy nutrient diet to maintain a healthy weight. And the fourth one is regular doctor's visit to prevent and diagnose early heart problems. So that was what we got for our flyers. We actually gave this out to them, and so they could keep it and go through and look at it and see what they need to eat and what they don't need to eat.
Okay, so the risk factors for cardiovascular disease are obesity, smoking, lack of physical activity, and hypertension. So one of the things we talked about was the lack of physical activity and some of the exercises that we could do. And somebody brought up the fact that it was expensive to join a gym or, buy weights and stuff like that. So something that was taught to me a long time ago was just to use things in your surroundings. One exercise that I learned that is very good for like weightlifting would be using gallons of water. So you could, or milk, you could get a gallon of water, and those are like $1 a piece, I think. So you could just use them to lift. And they're about 5 pounds a piece. So it just gives you a little bit to work with. You can also go, like, bend your knees a little bit, and then go side to side, like this, and it works your muscles right here. You can also use them doing squats, and that gives you just a little bit more weight to do squats with. Some of the other exercises were like jumping jacks, just something that is cardiovascular. If they can't do jumping jacks, then just do what they can. Some exercises that are very easy, especially for the older people, are walking, and just maybe a brisk walk. Walk as fast as you can, just enough to get your heart rate up. Some of the house chores that you do, vacuuming is an exercise. Even like scrubbing the toilet or the bathtub. That's using a little bit of muscle, so that's a little bit of exercise. So we did talk about that and how your common everyday activities is also an exercise.
So we also wanted, when we were doing blood pressures, we wanted to keep track of everybody who had increased or hypertension as their readings. We kind of wanted to see and evaluate how we did and how many people actually had blood pressures that were elevated. So out of the 32 people that were members of this church that were there for the presentation, 25 had stayed to do their blood pressure readings. Out of those 25 people, 8 were on blood pressure medicine, so they did have high readings, but they were also being evaluated by a physician and were taking blood pressure medicines to decrease their blood pressure. 12 had pre-hypertension or hypertension blood pressure readings and were not aware of that. So we really encouraged them to go and seek medical attention and see a physician and see if they can come up with a treatment plan for them. And 5 had normal readings. So it was something that opened our eyes. We read about it in books, knowing that Hispanics are at a higher risk for cardiovascular disease. But personally, I don't think we realized how true that is until we did the blood pressure readings at our community events.
During the presentation that we did at the church, we decided to throw in a game for fun to see if they learned anything. And we did Who Wants to Be a Millionaire? And some of the questions we asked were, all of these risk factors for heart disease, all of these are risk factors for heart disease except exercise, obesity, smoking, or lack of physical activity. And of course the answer is exercise. Another question was, which one of these is considered high blood pressure? And we put in there 100/60, 120/80, 130/86, and 146/94. And the answer was 146/94. The third question was, what is a way to prevent high blood pressure? And our answers were high sodium diet, watch TV all day, low sodium diet, and smoking. And of course the answer was low sodium diet. And then the question was, smoking is, and the answers are fun, leading cause in disease and death, a stress relief, not harmful. And of course the answer was leading cause in disease and deaths. And then decided to throw in some about strokes. So we said all of these are signs of stroke except confusion, uncontrollable crying, speech problems, and numbness on one side. And of course the answer was uncontrollable crying. And another one was for heart attacks. And all of these are signs of a heart attack except chest pain, fatigue, pain in one or both arms, and coughing. And the answer was coughing. The participants did really well, and they were very excited to play the game. They were very curious and had a lot of questions to ask us. We did give out prizes. We gave out a jump rope, water bottles, pedometer. We just had a lot of fun with it. Things that they can utilize to help to encourage them to exercise, drink, water, try and be a little bit healthier. Few statistics. Approximately 61% of Latino adults are overweight, and 22.6% of those are considered obese. The females aged 40 to 59 have the highest rates of being overweight and obese, and about a third being overweight and about half being obese. As of July 2013, the Hispanic and Latino population constitutes about 17% of the population in the United States. Of the 17%, only 29.1%, or there are 29.1% without health insurance as of 2012. So if they don't have health insurance, they can't afford a doctor, most likely, and so they are not getting medical care as they should, or it's being delayed. They're not able to get their medications for blood pressure and any other cardiovascular disease, maybe cholesterol, some of the risk factors. So this really delays the care that they are able to get. It's really important as practitioners that we reach out to the community so that we can help the people find resources that they need. A lot of it is emotional support that they might need to help them get motivated to exercise and to eat right. There was one research done that they're called promotoras, and they were facilitators for Latinas. And of course they spoke their language so that they could understand them. And they basically provided emotional support, and they helped them with their diet, taught them how to eat right, some of the exercises to do. They also had classes for healthy foods and exercise classes. So it's really important that we reach out to the communities, because if we don't, then they have no resources. They have no idea where to go. They don't know what to do, and they may not even know that they're really that sick until it's too late, before they're having a stroke or a heart attack. And it's really important to teach them all the signs and symptoms. So we put together a PowerPoint presentation for you with voiceover so you can hear us talk. Some of the objectives on it, I'm just going to go ahead and read those to you. Cardiovascular morbidity and mortality rates in Hispanic Latino population, the risk factors that are contributing to cardiovascular disease in Hispanic Latino population, the social aspects of the new life in America, cultural behaviors that can contribute to cardiovascular disease in Hispanic and Latino population, economic factors that influence proper screening, treatment, and prevention, factors that affect heart disease and what can be done to prevent cardiovascular disease in the Hispanic Latino population, and intervention of cardiovascular disease into the community. We have talked about some of these in this beginning video, but we go more in depth in the PowerPoint. And while you're looking through the PowerPoint, there are a couple videos that you can watch that are very interesting. And also throughout the PowerPoint, there will be some questions And keep an eye out for those. Thank you.